most of the time, the work of local public health professionals is invisible. That's because when they do their jobs well, the result is that nothing bad happens. People eating out at restaurants don't get food poisoning. Local residents don't get sick from contaminated water. Kids aren't exposed to lead paint. The fact is, when sickness and disease are prevented, no one notices. So local public health workers have gotten pretty used to flying under the radar, doing their critical work behind the scenes. But all that changed when COVID-19 arrived in Massachusetts. More people began paying attention to the work of their local boards of health. That's because in our Commonwealth, we rely on those boards to contain contagious diseases like COVID, using quarantine, contact tracing, and isolation techniques.
With the arrival of COVID, public health news was suddenly front page news. Everyone was talking about contact tracing, isolation, quarantine. The amount of attention was pretty overwhelming, and our phones were ringing off the hook.
As COVID rates rose steeply, the governor declared a state of emergency. Local public health professionals and volunteers were working overtime to report positive test results to the state, track disease clusters, trace known contacts of infected people, recommend quarantine and isolation solutions, provide food and other services to the growing number of people confined to their homes. In an effort to contain the virus, the state issued dozens of public health orders for businesses and the public. Local health workers rose to the challenge of interpreting and enforcing them, intensifying their already overwhelming workloads.
The early days of the pandemic were really a nightmare for local public health. We were scrambling to understand the rules, understand the science, communicate to terrified people with their diagnosis. We were struggling to find personal protective equipment for any number of folks who wanted it, like home health aides, businesses, our colleagues in local government. We were dealing with endless business questions about the rules from the lockdown. We were trying to communicate to the state what we needed, and the cases just kept coming and coming and coming. And it was exhausting and terrifying.
Inadequately funded even before the pandemic, local public health staff worked nights and weekends, shouldering the Herculean task of trying to keep all of us safe. And they were there for us again and again with each new wave of COVID cases, day after day, month after month. They fought to stop the spread. With the arrival of effective vaccines for COVID-19, a new responsibility was added once again. Local public health officials dug in, working with the state as part of a larger effort to vaccinate millions.
The truth is, without the efforts of our local public health workforce, things would have been much, much worse. From large cities to small towns, all across the state, they have made enormous sacrifices. We owe a huge debt of gratitude to each and every one of them.
And it's not over yet. We still have a long way to go to assure vaccine equity. And as we recover, it is up to all of us to make sure that our local public health departments have the resources they need to do their life-saving work.
Hi, my name is Damone Chaplin. I'm the health director for the New Bedford Health Department and board member for MPHA. I am one of thousands of public health professionals across the state, and here are a few of my colleagues.
I am public health.
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 And I'm public health.
I am public health.
I am public health.
I am public health.
I am public health.
We are public health.
On behalf of the Massachusetts Public Health Association and all Bay State residents, I want to thank our local public health heroes. We are truly grateful for your service.